here's the list of topics we're going to do from the book. I just wanted to show kind of like anatomy, a little bit of where things are. So we got 2 kidneys, right? You can't really feel them, but if you get punched in the back, right back here, it'd be right at like a kidney shot. You got the ureters that lead from the kidneys to the bladder there. Just kind of a more in-depth look of what they look like. There's a homework video about the anatomy, so we won't spend a lot of time going over it, but you can look at these slides if that helps you. All right, first kind of diagnostic we're going to talk about is a urinalysis. Have you heard of a urinalysis before? They're pretty common, especially if you've ever been pregnant or had a kid. You get a urinalysis pretty much every time you go to the doctor's office. They want to look at your pee, right, and check it every time. So what they're looking at is lots of different things. They usually take a little dipstick like this and dip it in the pee and kind of see, and they turn different colors to show like what's present in the urine or what's missing from the urine type of thing. So these are the kind of things they look for. They look at the color, if it's clear, if it's dark. Obviously, the clearer it is, the more hydrated you are, right? So this person needs to probably drink some water, right? They look at the clarity. The clarity is just like how clear is it? Can you see through it, or is it like really cloudy? Is it got sediment in it? So this one's pretty clear. Like you can see all the way to the bottom, right? So it's kind of like in a dirty pond or a clean pond. Can you see the floor, of the lake type thing? The odor. So obviously, urine doesn't smell good, but there's a level of foul odor that's considered normal. When it's really, really foul, that's usually indicative of some kind of infection, because that bacteria smells really bad. Also, like a fruity smell is actually indicative of diabetes. I know I keep referencing diabetes, and we haven't had that topic yet, but we will when we get to the endocrine system. The fruity smell is like a lot of times the presence of all this extra sugar in the urine. Then there's the specific gravity. This just measures how hydrated you are. Because the kidneys, their main job is to filter the blood, right? Anybody ever had a fish tank before? As a kid, I had like a huge aquarium with in the filter, it sucks the water through, cleans it out, spits out the clean water. That's essentially. Fish
ate each other.
Okay.
Yeah.
Well, that's essentially what the kidneys are. They're like a big filter of the blood. So they suck out all the toxins, all the impurities, then put the clean blood back into your system. So it's kind of like a fish tank in a sense. And so the specific gravity will kind of give you a number on how hydrated you are. So the kidneys can either, put extra water into the urine or less water. They kind of just work to show you how well the kidneys are functioning. Glucose, that's sugar. So normally there should be no sugar in your urine. Okay. If you do have sugar in your urine, that's usually indicative of having diabetes. Okay. Protein, same thing. Normally there should be no proteins in your urine either. If there is, that usually means there's some kind of kidney damage. So it's like the kidney itself is kind of breaking down and the proteins from the kidney end up in the urine, so that's bad. Blood, same thing. Normally there should be no blood in your urine. If you do have blood in the urine, it can be from trauma, like if you got kicked in the kidney, for example, it could be blood in the urine. It could sometimes if there's a little bit of blood in the urine when someone has a bad UTI, because there'd be a little bit of bleeding with the urinary tract infection. Also, menstruation. So when women are on their cycle, often there's blood in the urine, and that's considered normal when that occurs. They also look at the pH. Anybody know what pH means?
It's the balance.
Yeah, the acid-base balance. So like how acidic something is, So normally urine is a little bit on the acidic side. When it's more alkaline is the opposite of acidic. They also call it basic. Basic or alkaline is the same thing. You might hear of acid-base balance. You've heard that before? So alkaline is the same thing as base. It's just the opposite of acidic. When it's more alkaline, it's usually because of bacteria being present and making it more basic. Ketones also are normally not in the urine. When ketones are present, that's more indicative of diabetes. A lot of this will start to make more sense when we get to diabetes eventually. Diabetes is a pretty big topic and a disease that you'll see a lot of. Crystals, these are just like kidney stones, right? So sometimes there's little crystals in the urine. Obviously you don't want those, those are painful. So we don't normally want those in the urine. Same thing with bacteria. Normally there shouldn't be bacteria in the urine. If there is, some kind of infection is present. And white blood cells. Normally there should be no white blood cells. If there is, it's usually because there's some kind of infection. Most of it's pretty straightforward. Any questions about any of that? And then there's a couple blood tests that they do to look at the kidneys. There's something called blood urea nitrogen, creatinine, specific gravity, that's, I guess, urine, not really blood. And the GFR, which is also called the glomerular filtration rate. These are just lab draws, so someone takes a blood sample and it gives you an indication on kidney function. So blood urea nitrogen, this is one of those kind of toxins that if they're high, it shows that the kidneys aren't working. So you don't want your BUN. BUN is the blood urea nitrogen. If your BUN is high, kidneys are not working properly. Same thing with creatinine. If your creatinine is high, kidneys aren't working because these should be low if the kidneys are filtering out. Does that make sense? It's kind of like if you're looking at the fish tank and there's a bunch of gunk in the water, then you know that the filter's not working. Does that make sense? This I already talked about. This is a urine sample, not a blood sample. And then the GFR, or the glomerular filtration rate, this is essentially what it is it tells you what level of functioning your kidneys are working. There's something within the kidney called the glomerulus, and this, I don't know if you've taken A&P, it's probably been a while, but we're not going to get into all that in this class. But there's something called the glomerulus in the kidney, and the rate at which it is able to filter the blood and spit it back out is called the glomerular filtration rate. So the faster the filtration rate is going, is the better, right? It's working faster. If the glomerular filtration rate is really low, that means the filter is not working properly. Does that make sense? So we want it to be high, right? The higher the GFR, the better. If it's really low, the filtration is occurring very slowly and it's not going to be filtering out at the proper rate. Does that make sense? Try to just keep it simple, just so if you see these, you'll know what it's for. Like, okay, BUN and creatinine have to do with kidney function, right? GFR has to do with kidney function as well. So just being able to recognize what they're measuring. Like, does GFR measure heart stuff? Does it measure kidney stuff? That sort of thing. All right. Before we get into the kidney things, I did want to take a minute to kind of talk about the heart and kidney connection, because this is a pretty important concept, and we already talked about circulatory. So hopefully this will kind of help make sense. I told you that the primary function of the kidney is to filter the blood, right? The primary function of the circulatory system is to pump blood throughout the body, okay? So if there's any heart issues, like if someone has hypertension or heart failure, then they're not going to be distributing the blood through the body properly, okay? And the kidneys, just like every organ, need a steady, constant amount of blood flow to function, right? So in the case of, let's say, heart failure, remember heart failure is when the person's heart is very weak and can't pump properly, right? So it pumps slower, it's kind of weak and ineffective, it doesn't pump out strongly, remember? So if someone has heart failure and they're not pumping out enough blood to the kidneys will start to get damaged because they're not getting enough blood and oxygen. Does that make sense? Yeah. So then the kidneys are not going to be able to filter as well if they're damaged, right? Which means they're not going to be able to get rid of toxins. They're not going to be able to excrete the water in the form of urine as well. So if you're not excreting the water is staying in your body, right? And that's going to increase your blood pressure. Does that make sense? Because the water is staying in your system rather than being excreted out. So now you have higher blood pressure, which impacts the heart. So it's like this vicious cycle. Does that make sense? So heart and kidneys often go together. So someone can have heart issues that leads to kidney issues, or someone can have kidney issues that leads to heart issues. Does that make sense? Yeah. So oftentimes people with like heart disease, hypertension, whatever, will later down the line develop kidney issues or vice versa. So just being able to recognize that will make it a lot more sense when you're looking at people's charts and understanding like, okay, they've got both of they usually go hand in hand. Does that make sense?
Yes.
And you can, read through this a little bit more on your own time, but is there any questions about that? How that works, like how one causes the other?
That makes sense, like chronic kidney, or like, what's it called?
Heart failure?
Congestive heart.
Yeah.
Can be chronic
Yeah.
kidney.
Because like I said, the kidneys, they'll not just get rid of toxins, but they also like excrete the water. That in the form of urine, right? And if they're not able to do that, the water stays in your body and jacks up your blood pressure, which then puts stress on the heart, which then makes the heart not able to pump effectively, which then decreases the amount of blood getting to the kidneys, which damages them further, which then it just creates this vicious cycle. So, does that make sense? It kind of helps put things into perspective when you can understand the connection between the two. Okay, with that being said, we'll start in our first condition, which is acute glomerulonephritis. Long word, acute, so this is going to be a problem that happens very rapidly. This isn't a lifestyle or chronic issue. Glomerulo, again, is referring to a part of the kidney, and we're not going to go into the super A and P of the kidney, but glomerulonephritis is just talking about a portion of the kidney that is inflamed. Okay, so itis, inflammation. Okay, so what happens here is that this is usually actually seen in teens or kids after a streptococcal infection. So we've seen a few things now that are complications of a strep infection, right? Remember rheumatic fever, rheumatic heart disease, and circulatory, that was also related to a strep infection. So you're probably seeing now that strep is a pretty big deal, right? Strep is not something you just want to let go, right? Because it can cause further problems down the line. It can cause heart problems, it can cause kidney issues, okay? So strep is definitely something you want to get treated, okay? So what ends up happening here is the immune system ends up just going haywire for some reason, attacking those strep and let's show you a picture here. Remember we talked about the immune system, you got the antibodies and the bacteria. So these are the antibodies, this is the bacteria, and they clump on each other to try and get rid of them. But now you have all these big clumps of your immune cells, and they're clumping up in the kidney, which just cause clogs in the kidney, so the kidneys are kind of blocked. Okay, so all of this is happening inside the kidney. So the tiny little capillaries are being clogged with those immune cells, so the blood flow and everything isn't able to get through. Okay, so it's kind of like a clot in a sense, but it's the immune system that's causing the clot. So that will just end up damaging the kidney and having these problems. So symptoms-wise, proteinuria. Who can tell me what that means?
A lot of peeing.
Well, what is
Urine.
protein in the urine, right? So urea refers to in the urine, and protein. Because remember, protein in the urine is it normal or abnormal? Abnormal, right? So if there's protein in the urine, that's indicative of kidney damage. Okay, so all of this is happening and it's damaging the kidney. Edema, that's just the swelling, and people will have swelling because the kidneys aren't able to get rid of that water, right? So you'll start having fluid building up, getting those swollen ankles, this kind of the swollen, I've showed you pictures of pitting edema, where you press your fingers into the skin and it leaves that indent, right? So the kidneys aren't able to get rid of that fluid. Here's one, oliguria. Anyone wants to take a stab at what that one means? I don't think we've talked about ollie.
Is that your ear? Like on the tongue?
No, you're thinking of I see what you're saying.
Okay.
So oliguria is actually means reduced urine, okay, or almost no urine. So oliguria means reduced urine output. Hematuria, this one pretty easy. What do you think this one means? Blood in the urine. Great, good. So blood in the urine, again, those are all abnormal, right? We don't normally want blood in the urine or protein in the urine. Dark urine, that's just highly concentrated, right? And then high blood pressure. Again, why? Because the kidneys aren't able to get that extra fluid out, so it increases the blood pressure and it increases edema. Does that make sense? All of this happening. Diagnosis-wise, they'll do urinalysis. A lot of them are urinalysis. That's what I talked about in the beginning. All of these will be in the urine. Red blood cells, white blood cells, protein. The blood tests they can do are the BUN that we talked about. That's the toxin that the kidneys aren't able to get out. Elevated ESR, that's just the inflammation, right? Okay, treatment-wise, since it is related to bacteria, what do we think the treatment's going to be?
Antibiotics.
Yep, there you go. Pretty simple. Antibiotics, rest, diuretics. What do diuretics do?
Get the water out.
Yep, so the kidneys need some extra help, okay? So the diuretics are going to help get rid of that fluid, which will bring down the blood pressure and bring down the edema, okay?
Right, okay.
And then this one also, reducing Na, that's sodium. We've talked about before that sodium causes you to retain fluid. Anybody ever heard about if people with high blood pressure got to reduce their salt?
Yeah.
Yeah, because sodium attracts water. So the more sodium you have in your diet, the more water you're going to retain in your body. So just kind of trying to reduce sodium. And this is an acute problem, right? If you deal with it, get it treated, you'll go back to normal. There's no long-lasting problems unless it's not treated, and then it just leads to permanent kidney damage, right? If you just let it go and you don't treat it at all, like this temporary issue can become a chronic problem. Does that make sense? All right, on the other hand, we have chronic glomerulonephritis. Okay, so we just talked about acute, now we're going to talk about chronic. And here, I forgot I had a little picture. This is what the glomerulus looks like, right? There's like this little, this is where the filtration is actually happening. So the blood comes in, gets filtered, and then the clean blood goes out. So this is just kind of a visual of what the glomerulus is.
What? Sorry.
Do you have a question?
No, I'll look at it.
Okay. Okay, so chronic glomerulonephritis is not due to an infection like strep. This is a slow, progressive thing that happens over many years. Okay. Oftentimes, autoimmune diseases are the culprit because the autoimmune, they're just attacking itself, and they've just chosen the kidneys to attack. Okay, so in the acute one, it was in response to strep. This one, the chronic, there are other causes, but autoimmune diseases are very common, especially lupus, because lupus is very widespread, right? Lupus kind of affects the whole body, unfortunately. Symptoms-wise, initially in the beginning, you're not going to have many symptoms because it's slow and progressive, right? It's not like it happens overnight where you have all these problems very rapidly. It's kind of a slow, insidious onset. Then you will eventually start developing like hypertension, the blood pressure, right? Hematuria, just kind of like the one, just like we talked about with acute, they just take longer to appear. Proteinuria, oliguria, edema, so they're all the very similar symptoms. They just don't happen quickly. They just take slower to come. In the later stages, as we're getting toward like end stage, like renal failure, severe hypertension, like just really, really bad, like you could, really high levels. And then azotemia. This is referring to toxins in the blood. So azo is just referring to, I don't know what that root means, it's just toxins. And then in the blood will lead to uremic frost. So this is actually pretty interesting. Here's a picture of uremic frost. Basically, since the kidneys aren't able to get the toxins out in the urine, they start coming out through the pores. Okay, so like as you sweat, like you're sweating out your toxins, and it's like this weird kind of like flaky crystals that are coming out of someone's pores, trying to get rid of those toxins. So
What is that his head?
that, huh?
Is that their head?
Yeah, this is their forehead, eyebrows.
I was just looked up
Yeah,
and thought,
it is.
what is that?
Yeah, the lighting isn't great for you guys. I'm sorry. You can, if you want to turn the lights off, you can.
It's
if
fine.
it
I
makes
just
it-
had to look up. What is that?
Yeah, that's a forehead.
Right,
They're
okay.
sweating out like the toxins since the kidneys can't do it.
I can't even imagine this.
Ew.
Yeah. Well, this is a late stage, right? So this is like the
Right.
kidneys can't do anything.
Right.
Yeah.
Well, I bet you it's so sad.
Probably does. Pruritus is itching, right? So you can imagine all that stuff on your skin's pretty itchy. So the diagnosis is kind of the same thing as the acute, the urinalysis and all that stuff. So treatment goals here, we want to control the hypertension because remember, if blood pressure gets so bad, you can have a stroke, right? You can burst, you can have an aneurysm. Somebody should have, more problems, right? So keeping the blood pressure controlled with, blood pressure medications, preventing the heart failure, which is related to the high blood pressure. Just fluid and sodium restriction, making sure they're not having too much sodium in fluid. Avoiding NSAIDs. You know how we talked about NSAIDs are damaging to the digestive tract? They also can hurt the kidneys too. So even though NSAIDs like ibuprofen and stuff is available over the counter, they're pretty, actually one of the more dangerous drugs that people just don't realize it because they think, oh, it's just ibuprofen, it's just an Advil, right? But they can, if taken too much, they can cause ulcers, they can cause kidney damage, they can cause hypertension. So it is a drug to be aware of. And then treatment also might include dialysis at some point. Anybody know what dialysis is?
That's when they clean your blood.
Yeah, so basically they hook you up to a machine. Let's see if I have a picture. Yeah. So they hook you up to a machine, put a needle in your veins, sucks the blood out into this big box, which is essentially just like a mechanical kidney, right? It cleans your blood and then puts it back in when it's done cleaning it. So since your kidneys can't do it, they're going to do it for you. and you have to come in usually multiple times a week to get this done, and it takes several hours, and it's really not a fun thing to have to do. You have a question?
I'm just thinking about that process. I know a lot of people who do it.
Yeah.
You should see it when they stop doing it, when they're just gonna let them pass away.
Ooh, yeah.
What that body looks like.
Yeah. The downside to this is that you have to come in and do it, right? Like, well, your kidneys typically are filtering all the time, right? Whereas, your blood's gonna stay dirty till you come in and get it cleaned. So you have to, usually come in a few times a week to get it done.
So the machine knows when all your blood is clean?
Mm-hmm. It's pretty advanced, equipment. They can take out all the toxins, take out extra water, and then put the cleaned out blood back into you.
It
So-
trains the patient.
Yeah, it
the
trains
patient.
right because it's sucking out their blood.
Yeah.
They're so tired
Yeah.
when they come back.
Wow.
Yeah, it's definitely not a fun process, but it's, to keep someone alive. So,
Yeah. Wow.
and like I said, this form is chronic and progressive versus the acute form, okay? Any other questions about that one? Okay.
Oh, body goes through so much, man.
Yeah, the more you learn about healthy things that can go wrong, it's amazing that we are generally healthy, like day to day. All right, so acute renal failure, there's multiple different causes. This is just kind of an umbrella term to talk about like any situation that is an acute problem, okay, that's going to cause like a kidney sickness in a sense. So there's 3 different types. There's pre-renal, intra-renal, and post-renal. Basically what this just means is, okay, you're having a kidney problem. Where's the problem coming from? Okay, is the problem coming before the kidneys in the sense of like, maybe it's the heart, right? Maybe the heart has the problem and it's not pumping enough blood, right? So the kidney isn't getting enough blood. That would be a pre-renal condition, right? Like the kidneys are being affected, but the problem isn't with the kidneys, it's with something before the kidneys. Does that make sense? So like if someone had a heart attack, for example, and now their heart is pumping poorly, not getting enough blood to the kidney, that is a pre-renal cause. Intrarenal, this means the problem is actually within the kidney itself, like something is wrong with the kidneys. And then post-renal is something that's after the kidneys. So like for example, if someone gets a kidney stone, right, and that stone is blocking the flow of urine, right, and you can't urinate past that kidney stone, that would be post-renal because the problem is after the kidneys. Does that make sense? Or maybe someone has a tumor and the tumor is blocking the bladder from being able to empty. That's a post-renal problem. Does that make sense? So it's kind of an umbrella term saying like there's lots of things that can cause kidney problems, and there's three types. Something before the kidney, in the kidney itself, and after the kidney. Regardless, the kidney is going to be impacted, and the symptoms are usually going to be oligurous or reduced urine output. Right? If the kidneys can't do their job, they're not going to be able to make urine. Headache, drowsiness, altered level of consciousness as those toxins build up. Anybody ever heard of encephalopathy before?
Yeah, that's what your brain.
Yeah, so it's kind of an induced like psychosis almost, where you kind of just go crazy a little bit. And kidney disease can be one of those reasons, where it's like all those toxins staying in the bloodstream kind of like go to your brain and kind of make you a little nuts. Yeah. Are you saying something?
Because my grandpa has sepsis. Remember I told you?
Has what?
He has sepsis.
Sepsis.
But he also has chronic kidney,
Uh-huh.
and he also has with his heart. I did read his chart, and so now I'm like
Just putting the
understanding
pieces
more.
together.
Yeah.
Yeah. Well, you
And
start
I'm
to
like,
see.
How you got that? How
Yeah.
you got that?
Yeah,
Okay.
a lot of it is put
It goes
together.
together.
Yeah.
Yes.
So a lot of the times, all those toxins in the bloodstream can like make you confused, make you kind of agitated, make you irritated, make you kind of like maybe delusional. Because it's like being on drugs in a sense. It's like the toxins are in your bloodstream, getting to your brain, and kind of making you go a little crazy. So that's what altered LOC is, altered level of consciousness. Diagnosis-wise, they're going to be doing that kind of same thing. The blood tests, looking at the the toxins in the blood. One of them being the BUN, the creatinine. They can do a renal ultrasound. This, you know what an ultrasound is, right? Like they look at the baby, right? So they can like look at your kidneys and see if they can see like maybe a kidney stone in there, or like if they can see inflammation or whatever, just kind of see what's going on. And it kind of depends on what's happening, what they're going to do, right? So the treatment is going to kind of vary depending on what's the problem. If it's heart, they're going to try and treat the heart. If it's something within the kidney, they'll try and do that. If it's post-renal, they'll try to get rid of the blockage or whatever, what have you. Regardless, blood pressure meds are usually always going to be related to kidneys, okay? Like I said, because of the heart-kidney connection. So you might be like, why are these people on blood pressure meds if it's a kidney problem? Because the kidneys can cause high blood pressure, okay? Diuretics, again, to get rid of extra fluid, and dialysis if necessary, okay? Any questions about this one? Let's see. Let's talk a little bit more. There is something we haven't talked about yet. Certain medications have the potential to be what's called nephrotoxic. Okay, whenever you hear nephro, that's referring to the kidneys again, because the kidneys have glomerulus in it. They have something called the nephron. So whenever you see those things, just know it's talking about the kidney. Nephrotoxic are just medications that can damage the kidney. We talked about it a little bit with the eye and ear. Remember ototoxic drugs? Drugs that can damage the hearing. So that can be, if someone takes a medication that has nephrotoxic qualities, that can be an example of intrarenal renal failure, right? If the medications are to blame. We also haven't talked about this one really because we'll be talking about this one next unit in reproductive, but enlarged prostate, men have prostates, their urethra goes right through the prostate. When those are enlarged, it can pinch off the urethra. If they get too big, it's kind of like a tumor in a sense, pinching off the urethra. Let me draw you a quick picture. So, the urethra is what you pee through, right? And for men, they have a prostate that literally goes right around it, okay? So as it starts to grow, it starts to put pressure and narrow the urethra. So make it very difficult for urine to get through. So it's kind of hard to talk about this, not talk about this one in urinary, but they save it for reproductive because it's technically part of reproductive. But I just want to mention it now so that you can understand. That's also an example of a post-renal example, because the problem is with the flow. After the kidney. Does that make sense?
Yes.
So there's lots of different things that could be happening. They just fit into one of these categories, is what I'm trying to say. Does that make sense? I know it's a lot. I don't like kidney. It's my least favorite topic, but we're gonna get through it. We're gonna get through it together. All right. Chronic kidney disease. There are two main causes of chronic kidney disease, although there are multiple, right? Lots of things can lead to chronic kidney disease, but the most two common, especially in America, are diabetes and hypertension. We talked about hypertension already, why that happens, and we'll talk more about this when we get to diabetes, but just so you can kind of have an idea. Diabetes, the issue is with sugar regulation, right? So the people's blood sugars are too high, okay? So again, the kidneys are what's filtering the blood, and if there's just a constant level of high amounts of sugar, that sugar is actually very irritating to the blood vessels in the kidney. Okay, so just imagine like a fish tank trying to filter out something that's like really thick, really hard to process. It might damage and clog up the filter. Okay, it's the same idea with the sugar in the bloodstream. Those sugar crystals are very irritating to the small little blood vessels in the kidney. So over time, that's just going to damage the kidney. Okay, so diabetes, hypertension, main two causes in America, especially for chronic kidney diseases. Some of the other ones we kind of mentioned a little bit. Untreated acute disorders. So any acute disorder can become chronic if you don't treat it, right? The benefit of acute disease is that if you address it, it's fine, but if you don't address it, it can cause permanent damage. Chronic urine obstruction, like with the prostate issue, that can cause kidney damage. Autoimmune, always. Nephrotoxic meds, so just medications that damage the kidneys. All right, so symptoms of this is going to be abnormal urine output, right? Again, the kidneys can't do their job. They can't produce the urine. Feeling weak and tired just from the lack of having all those toxins in your blood. You don't feel good, right? You just feel kind of bleh with all that toxins in your system, Hypertension, again, swelling. And as the toxins increase, the uremia increases. you'll start having other issues like arrhythmias, just because it can mess up the heart, right? Weakness, difficulty breathing, just the kidneys can impact the whole body over time.
Oh, wow.
Yeah. Kidneys and heart, man, it can really mess you up. Diagnosis is going to be very similar to what we've already been talking about, looking at the blood, the elevated BUN and creatinine. So here's one that's different. Decreased hemoglobin and hematocrit. I don't know if you remember, hemoglobin and hematocrit has to do with the red blood cells. Okay? The reason why that's going to be low is because the kidneys, not only do they do the filtering, right, but they also produce a hormone called erythropoietin. Okay, what do we know about erythro? What's that root mean?
White blood cell.
Red.
Oh.
Red. The leuco,
Glucose
that's
white.
right, yeah. So erythropoietin is a hormone that the kidneys produce when it's healthy, and erythropoietin helps to stimulate the production of red blood cells. Okay, erythropoietin, erythrocytes. Okay, it kind of gives you an idea. So if the kidneys are damaged, they're not going to be able to secrete that hormone, which means that your body's never going to get like the stimulus to like make more red blood cells. So you're just going to not produce them as well. So a lot of times people have like anemia when they have chronic kidney disease. So that's something different. And then the urinalysis, or the UA, that's a urinalysis, again, is going to show increased glucose, protein, white blood cells, all the abnormal stuff that shouldn't be there. Okay, so not only is it going to have less urine, but what's in the urine is going to be jacked up. Okay. Treatment-wise, there's really not much you can super do once it becomes like irreversible and chronic kidney disease. You can do dialysis, at a certain interval, depending on how bad it is. Some people might need it every other day. Some might only need it once a week. It kind of just depends on how bad your kidneys are. Kidney transplants are also pretty common. Because eventually your kidneys just aren't doing anything, right? Like you just need to get a new one. You can live with one kidney, right? So like a lot of people donate a kidney, like if to a family member, because you have two of them, right? So you can live with one. It's just you got to be careful because you only got one now. You got to treat it well. And most of the time, these people are going to be on chronic diuretics and blood pressure meds. That's the antihypertensives. And also maybe some synthetic erythropoietin. Those are like little injections that people can take to help address the low red blood cell issue. Okay, does that make sense with the erythropoietin? With the kidneys producing that hormone? Yeah. Okay. And yeah, chronic and progressive. Unfortunately, the body is pretty good at healing itself with acute issues. But there does come a point of no return where like it's now damaged permanently and you can't fix it.
You know what? It's just crazy. I'm sorry, y'all.
You're good.
It's just crazy how all of this works. It seems like every time something happens, we talk about it.
Yeah.
So, okay, because my girlfriend, he has a chronic kidney disease, right?
Mm-hmm.
And he got stage 4.
Stage 4, yeah.
So he should be doing dialysis.
Yeah.
He refused.
It does get to be annoying after,
Yeah, but he never had it, right?
Never.
And so I was like, how he's still alive? Like,
Yeah.
how is he still, like, But, okay, now it's explained to me how he could get the sepsis because he's not doing what he's supposed to be doing to keep himself regulated.
Yeah. It's cool. I mean, it's not cool to have a real life experience because that's bad. But like when it starts putting the pieces together, you can see, you can take something from real life and like understand.
Yes.
Not that I want your grandpa to have all these problems.
But now I understand like the things that can happen.
Yeah. It's the light bulb moments are kind of fun. All right, let's see. The next one we have is pyelonephritis. You guys have probably all heard of a urinary tract infection or bladder infection, right? So this is just basically a really bad one that travels up into your kidney, right? So usually a bladder infection is in the bladder, right? But it can travel up the ureter and get into the kidney itself. So yeah, like I said, bacteria, usually E. coli is the bacteria just because that's what's in feces. E. coli is like the main bacteria in your feces, and so especially for women, wiping, the wrong direction can bring E. coli into the urethra, right? It's a little harder for men because there's a lot more space in between the two, but for women it's like a very short distance, and the women's urethra is a lot shorter, right? The women's urethra is like this short, whereas men's urethras are much longer, right? So it's easier for bacteria to travel up into women. It travels up the urethra, can get into the bladder, and the bacteria love being in the bladder, okay, because it's dark, it's warm, there's water, it's like the perfect petri dish for them to grow, okay. They love being in there, and then once it gets really bad in the bladder, it can start traveling up the ureters and get into the kidneys themselves. Urostasis of urine, that's when people hold it for a long time, or like they're not constantly like flushing their bladder out. That allows the bacteria to sit in there and just grow, right? The more often you're like urinating, you're flushing out that bacteria, and it doesn't give them a chance to really grow as fast. So that's why like drinking a lot of water and like urinating frequently helps decrease urinary tract infections, because the bladder like will empty out all the bacteria and they have to try and start over. Does that make sense? Like if it just sits there for a long time, they have a long time to just like breed and grow. So urinating frequently helps to diminish this. Same thing with intercourse. A lot of bacteria can get into the urethra from intercourse, so that's why urinating afterwards to kind of flush out the system, kind of get that bacteria out, is helpful. And catheterization. Anybody know what catheterization is? Getting a catheter, maybe a Foley. Anybody heard of a Foley? It's I think I have a picture of it. Hold on. I think it's coming later. But basically, it's like a little tube that goes up through the urethra into the bladder and drains the bladder out. A lot of times people have them when they go into surgery, right? But I'll show you a picture when we get to it. But that all increases risk. Anytime there's something going up into the urethra or into the bladder, like it increases risk for infection, because you're bringing something up in there that shouldn't be up in there. So symptoms of this is just, the kind of normal symptoms when you have a UTI, like that burning feeling, maybe a fever. The flank pain, that's referring to like pain right here, like in your kind of lower back, because that's where your kidneys are, right? Flank pain refers to the kidneys, so like if it's traveled up into your kidneys, that would hurt there, right? Fever and chills, just because it is an infection. Those are kind of the main symptoms. Diagnostic-wise, they're going to do a urinalysis, right? They'll see red blood cells, white blood cells. They'll do a culture. They'll see the bacteria in there. There shouldn't be bacteria normally in your urine, so they'll see all this. It's pretty easy to diagnose. You just do a urinalysis. Like, yep, you got an infection there. And then the treatment's just going to be antibiotics. And we talked about increasing fluids. And this is an acute problem, right? If you address it, no lasting damage. Any questions about pyelonephritis? This is just a kind of a picture, like the swelling of of the kidney itself here. All right, next we got hydronephrosis. What does hydro usually refer to? Water. Perfect. And then neph refers to the kidney. So hydronephrosis is due to extra water being where it should be. So I'll show you a picture here. So this is an example of a kidney stone blocking the ureter, and so the urine can't get out, right? So it starts backing up into the kidney, so you can see how it's starting to get swollen like that, and that can damage the structure, right? It's like a balloon filled up with too much water might pop, right? So it's not supposed to get backed up like that. This is hydronephrosis. So like I said, abnormal dilation caused by pressure from urine that can't pass due to an obstruction, okay? And so a kidney stone isn't the only thing that can cause this, but it is like one of the more common ones. Kidney stone, that's a renal calculi, that's the medical term for kidney stone. A tumor could do the same thing, right? You have a tumor growing somewhere that pinches off or blocks the ureter. Pregnancy often too, because everything is squished in pregnancy, right? Like a lot of complications can happen, a lot of like, if the baby is positioned a certain way, it can cause an intestinal obstruction. If like maybe their foot is clamped down on your intestine, just a lot of things are squished with less space. We talk about the prostate. That's the prostatic hyperplasia. Hyperplasia just means excessive growth. Okay, so that prostate growing too big. Congenital, that just means you're like the way you were born. Anything essentially that prevents the urine from exiting properly can cause hydronephrosis. Okay, those are just some examples to kind of get you an idea. Symptoms-wise, generally there's not many symptoms. You might have like a vague backache, and the backache is because that's where the kidneys are, right? So it's like kind of like this crampy feeling back there because they're getting stretched and swollen. Urine obviously is going to be decreased because it can't get through. That's the whole problem, right? The urine can't exit. The reason why often there's not many symptoms is because you have 2 kidneys, right? So you're still going to be able to, normally you're not going to have it blocked on both, right? It's rare when both are blocked at the same time. Usually it's one. So like you're still peeing somewhat, like the other kidney's still working. It's just the one kidney that's having the issue. So you might not really realize that you're having these symptoms. Does that make sense? Diagnosis wise, oftentimes it's found by accident. Like people are getting like if they're in for a routine ultrasound with the baby or whatever, and they notice like on the ultrasound that the kidneys are funny. Imaging wise, like I said, most people don't necessarily know because they have the other kidney that's working fine. The treatment is just to remove the blockage. So whatever's causing that blockage, get it removed, get the urine back to flowing. They could do something called a nephrostomy tube. You remember the ostomy with the intestines? It's kind of the same idea, except this goes into the kidney, and then the tube goes like right where that urine is collecting. So you can see it's going right here, which is right in there, right? So then it helps to drain out that fluid so that you're not going to cause permanent damage to that kidney, right? Like by having it swollen beyond repair. Does that make sense? So it helps to drain that urine out while they fix whatever the problem is. Okay, does that make sense? But yeah, not everybody gets this. This is just an option of a treatment. So if you see nephrostomy, you know what it's for. All right, we've talked about this a couple times now. Renal calculi, that's just kidney stone, right? Lots of different things can cause a kidney stone. Anybody ever had one? You have? Did you have any like testing done on it? Sometimes they'll have you like pee through a little strainer, like one of those really, really tiny strainers, so they can catch any crystals that come out. And then sometimes they'll have you like send those in for an analysis to see like
I
what.
kept mine.
You kept yours?
Yeah, I've had two of them.
Were they big?
The first one must have not been big because I must have passed it. The second one made me really sick. Like I struggled trying to pass it. I thought I did pass it the next day.
And they can be real painful.
Yeah, like I couldn't eat or drink. I was throwing up.
Yeah.
I finally went to the emergency room. They tried to tell me I had a bladder infection or something. I kept telling them, I know it's kidney stone. I know what it is. And then she tried to catheterize me to get a urine sample.
Yeah.
So I don't know if when she did that, she unlodged it because when I went home, they gave me pain meds and I passed out because I was that and gave me fingerprint. But I woke up the next morning and went to the bathroom and I passed it.
Okay.
So I don't know if her catheterizing opened my urethra tube before I could pass it.
Yeah.
But it's big. I mean, it's probably the size of oh my gosh. It's bigger than a grain of sand.
Yeah.
So, but yeah, it's got little spots all over it.
Yeah, they're usually pretty sharp.
Yeah.
That's what hurts passing through the
Passing
ureters.
through.
But sometimes if someone is really prone to them, like they get them a lot, that sometimes they can do tests on the stones. Like they'll send them into the lab for analysis and be like, oh, they're made up of calcium or whatever. And some like tell me, okay, like reduce your calcium intake. Like sometimes people are on like excessive calcium vitamins.
My dad gets them and
Yeah.
he's weird. He has a whole jar full of
Yeah. So there's just different things in the
And
diet
uses
that can.
calcium.
Yeah. So some people have taken too much calcium. Some people drink too many sugary sodas. Sugary sodas are a big risk for kidney stones. So if someone's just really prone to them, yeah. Yeah.
Mine's usually caused by dehydration.
Yep, that's another one right here. Dehydration is another cause. Just there's lots of things that can cause them, but you know, they all suck. So.
Yes, they do.
They do the thing where they break them up. If they
Yeah, we're about to talk about that.
Oh, okay.
Yeah, good job. So symptoms wise, it kind of depends on how bad it is. Like if they're small, they'll hurt, but they'll still pass. Other times they're like real big and they get stuck, and then we have more of an emergency, right? Because it's blocking it completely. There will be some hematuria, which is the blood, just because they scrape, right? As they're getting past, they scrape down the ureter and cause some bleeding. Fever, chills, nausea, vomiting, like she said. Diagnosis, like I said, urine sample. You have a question?
Yeah, so the other one where it was like the obstruction, is it not painful when it's like stuck in the kidney?
Oh, it can hurt, yeah, for
Well,
sure.
Okay, I was just wondering because that like you know the symptoms or whatever that wasn't really
It makes,
listed, so I was
yeah.
wondering if it hurts at
It
that
almost
point.
makes you feel like you're constantly having to go pee, but then
Yes.
you can't pee, so then you can feel like your kidney, like you can feel it in your back, your kidneys and stuff hurt.
It depends how bad it is, right?
Yeah.
Sometimes they're small and they hurt a little bit, but they're still coming out. Like they're small enough to fit through the ureters. Other times they're bigger and they like get stuck or scrape down, so they can have varying levels of symptoms. Some people have kidney stones all the time and don't even know it because they're so small they just pass. So it's kind of hard to say what everyone's symptoms are going to look like.
Yeah, I was just curious about the ones that were like stuck in the kidney, basically with that obstruction. One we're talking about.
I don't know. I would imagine it probably would hurt. I've never had one, so I don't know. I cross my, I hope I don't get one. Yeah, diagnostic. They're gonna look at a urine sample. A KUB. Anybody know what KUB imaging is? Anybody ever heard of that? It's just an acronym for kidney, urinary, and bladder. Kidney, ureter, and bladder. So it's just an imaging, a scan specifically of those three things to see if they can see where the kidney stone may be. Because it could be stuck in the kidney, it could be stuck in the ureters, or it could have already traveled down into the bladder. They don't know where it is until they see it. Same thing with ultrasound, CT, all of that. Treatment, obviously, is get rid of the stone. Drinking a lot of water, because sometimes it can help flush it out. Lithotripsy, you were mentioning the breaking it up, Amanda. That's what lithotripsy is. They take like this high speed kind of vibration thing, and it like shakes them up and like breaks them into smaller pieces so that they're easier to pass. Because sometimes there's like a big old one and it's like there's no way it can pass through. Sometimes they'll do surgery to remove it, but often we want to do the least invasive option, right? Like having an open surgery to remove a kidney stone is, less ideal than just breaking it up and letting it pass naturally, obviously.
What they do, a stent or something?
A stent, they have some people like if like the ureter itself is really swollen, like kind of shut just from irritation, they can put a stent in to allow it to flow better.
Okay.
So that might be in the case of like if someone had a really bad infection and it's like really swollen, you can put a stent in to open it back up. So lots of different
I kept
things.
saying, why is it say stent on here? I thought it said on his heart.
Yeah. Well, you can have a stent anywhere, right? You can have a stent in your.
Yeah, but it was
Mhm.
for his kidneys.
Yeah. Yeah.
I didn't understand that. Yeah, I was like, why say stent?
Mm-hmm.
When
Well,
it's
stent
on
is anything that
his
just opens it up, makes it easier to pass.
Yeah.
So you can have a stent in your kidney, you can have a stent in your heart, like anywhere where you need the
Anywhere.
flow to be better.
Got it.
Mm-hmm.
Okay, that makes sense. Okay.
A uretoscopy is just a camera that looks up into the ureters. Remember, like endoscopy in the digestive system was a little camera. Analgesics, that's just pain meds. Here's a new med. We've got something called Flomax. We'll talk about this at the end, but Flomax, well, I think it's easy to remember because it maximizes the flow. Flomax. So it helps open up the ureters to make it easier for the stones to pass through. Yeah, usually these are acute, right? They pass, they don't usually cause any lasting damage, but some people are more prone to getting them recurrently, and then that would be more when they want to maybe do a test to see like why you're getting them so often. Right? If you have it like one time, they're probably not going to go through all that. Here's a real bad case. Can you guys see that, or is it blurry? This is a kidney full of kidney stones.
Oh my
Yeah.
God.
So obviously this person has a real bad case. Here's an imaging, the KUB, like I was saying, the kidneys, ureters, and bladder. This is actually a stone, that big old thing. That's what we call a staghorn calculus, when it like fills up the entire space in the kidney. So it's like one solid mass rather than like tiny little stones. You can actually see that show up on imaging. Isn't that crazy? These are obviously like extreme examples of like, this isn't like normal.
Yeah, that one kidney is out of the body, so maybe that person died.
Well, maybe. Hold on.
I mean,
Oh, that looks.
Yeah.
That's a lot.
Yeah, see, this right here, this is all the stone.
I would die.
I'm like, let's go.
Yeah, see, this is an example of something that obviously can't pass.
Yeah.
Like, how is it gonna pass?
Right.
Like, you're gonna have to get surgery to have this removed because there ain't no way that's coming out, right? Like, it's just not. And then this one, you probably wish you would be dead rather than pass
Yes.
all that.
Yes.
So
Oh, my
They said I had 5.
this is a microscopic, like, more in depth. See how it's spiky? It's
Yeah.
not just like a tiny round rock. Like you can
Right.
see like why it would scrape coming out because they're like snowflakey. They kind of like have all these little branches coming out. I always show you guys the extreme examples because they're more fun. But okay, let's take a little bit of a break. You guys want how you guys feel? Do you want 5 minutes, 10 minutes? I want to make sure we get through
How much
everything.
time we got?
You gotta
Okay.
get through
Let me see, what number are we on? Cystitis.
Oh, God, we go to 51. But most of them are pictures.
Yeah, that's true. I'll do take 7 minutes or so.
Okay.
Do some jumping jacks, get some blood flowing, whatever you need to do. Go to the bathroom.
Tell my friend to get my,
Get a snack if you want a snack.
And I be telling my brother, they be think I don't know what I be talking about.
Huh?
I'm finna call him, tell him, cause he just went and brought grandpa a whole 6-pack of Pepsi. I said, he don't need them Pepsis.
How old's your grandpa?
He'll be 90 in June.
He probably just like, you know what? If I'm gonna go with my Pepsi.
Yeah, that's what I'm saying. My brother be saying the same thing. Just let her have what. Yeah, okay, but he just had sepsis because he had a renal calculi.
Yeah.
You know what I'm saying? And he had sepsis bad. We found him lethargic. Da, da, da. He had to go to rehab for 14 days because his motor skills. Da, da, da. Now he's back home, and some of his stuff came back because he's just a determined old man. Okay.
Men are the worst when it comes to
Yes.
this. I'm sorry, but it's just true. They
And I
hate
get
going to the
it.
doctor.
Yes, and I get it. He's gonna hold on as long as he can. He's strong.
Yeah.
But this could happen again.
I think also too, it gets to the point where you're at a point of life, you're like, I'm gonna die at some point. I want to have my Pepsi. I want to have my beer. People don't want to, you know what I'm saying? You're like, and I get both sides of it. It's like, hey,
I'm not finna go home, wake up one day, go in his room, and he in there.
My grandma won't stop drinking Coke. She has 1 kidney. So,
See?
and she just fast food and Coke every day.
That's what he
how old
wanted.
is she?
Burger King burger.
74.
Okay.
And then her brother has all the dialysis, and I'm like, and she talked about how terrible he looked. And
But they don't
yeah,
care.
she gotta cause he's like special a little bit, so she had to take him because he can't read or write. I'm like, you
Okay.
see that?
Right.
That's what we do.
They don't care. They don't care.
At least you get 2, so like, it's not like you got one heart.
Right,
So,
right. But still.
You can
And
live
you
with
get
one
mad.
lung. You can live with 1 kidney.
He get mad. He
My
get
mom,
mad.
she's a RN, and my granny, she doesn't like to drink water, so she always gets like the
Oh
tap
gosh,
water.
it's so hard for me to drink water.
And she was like,
What? I love water.
But I know I have to because I read about this all the time. I'm just like,
Yes.
all right, you must do it.
because she's like, I drank 2 of the little waters, like the half size.
Oh my
And
gosh.
she literally goes to Publix, get the BOGO deals, and she gets little waters. And she's like, I jumped, because my mom be on her, because she's a RN.
Yeah.
She's like, I jumped 3. She's like, you're supposed to drink like 10.
Right.
Yeah,
I jumped 2.
yeah.
My grandpa's like, I don't need no water. Bring on them Sprites.
Well, the problem is when you get to a certain point in kidney failure is that they actually put you on a fluid restriction because it's like overloading the kidneys with too much water. Like, it helps prevent the kidneys from getting damaged, but once the kidneys are damaged, it's like too late now. Now you gotta
Yes.
like actually cut back on the fluids, right? Because now it's like it's too much and the kidneys can't keep up. So
Right.
so you gotta give it a little bit so it can like, you know what I'm saying?
Right.
So
Did she
Filter
donate her
through.
kidney or did she actually just lose it?
I think it runs in the family. I think that's how her mom died. Because her mom died in like her 40s.
Did you have
Wow.
kidney cancer or something?
I think she had stones, and my granny just drinks. She's from the old age, so
Yeah.
soul food and
Yeah.
Maybe that kidney we looked at was hers.
Yeah. Okay.
Maybe that was her kidney right there.
Yeah. I gotta ask her. I think it was when I was born or before I was born. She lost that 1 kidney. And she's COPD. And a bleeder.
Anyone have any questions about anything?
Yeah.
Scroll back while we're waiting for people to get back.
No, that's just crazy.
Sadly, my grandpa died from COVID, but he sounds just like your grandpa.
Yeah, I'm
So
telling
that
you,
was
he don't care.
acting up in the hospital.
And here's the part.
That's a man.
When he
It's a
was
guy.
going through the sepsis thing, we didn't know that's what was going on.
Yeah.
Okay.
Because sepsis can be caused by
Right,
So many
we
different
didn't
things.
know. We
Yeah.
thought it was because he ran out of his meds, he was in pain. That's why he was saying he was hurting. We didn't know he had a calculi. Okay, and then as a result, he had the sepsis. But that was after we found him lethargic. Now it's that. Okay, so he was like out of it. You know what I'm saying? For a few days or whatever when they took him to the hospital. So yesterday he told us that he knew when he was out of it.
he knew.
Yeah, like he don't, okay, like he didn't know he was out of it, but now that he's back to normal, he's like, he knew he went to the hospital, he knew he wasn't saying things that made sense to us, but.
Altered level of consciousness?
Yeah. Is that crazy or what?
Yeah. See, it's like the vicious cycle with the heart and the lungs. All starts to pile up on top of each other.
Yeah, but my thing is he don't care. He don't want to do nothing about it. He just feel like we all gonna die. And I would say, okay, Grandpa, but we ain't trying to put you in the grave tomorrow. Like, come on.
It's like you with that attitude.
Yeah. You're like, and
Oh,
you're
our
up and
citizen's
down.
Hmm?
She had a tumor on her kidney.
Oh, she had a tumor? Yep. So kidney cancer.
You said it was what?
So kidney cancer.
I done lived
Oh,
with
yeah,
that.
that's what.
Yeah.
I was the same way. Doctors say all the time, you need to quit drinking, you need to quit drinking, you need to quit drinking. What's he do? Go straight home and start drinking more. Nope, they don't.
I mean, he care, but you know, sometimes I feel like he be like he's ready because you know he's 90 or he'll be 90 in June, and like all his brothers and sisters, his classmates, like everything he knows, he grew up is gone. They're all dead. Everybody's dead. He's the only one left in the family. You know what I'm saying? His brothers, his sisters, everybody's dead. His aunts and uncles, like they're all dead.
He
Yeah,
said,
his
"I'm here by myself, I'm here by
yeah,
myself."
his cousins, his friends, his fishing buddies,
No.
they all just dead. And
That's a sad life. to
Yes.
live. To be honest, to live past everybody else. and
everybody
you
else.
by yourself.
Yep, that's what I'm saying. That's why I think he do that sometimes. He just be like,
I think that's probably why he has the attitude of like, whatever.
Yeah.
You know, they get to a point where they're like, I want to just have my comforts and.
and then he still wake up every day.
Sometimes I think people of that generation were just made different. Because I swear, like, my grandpa too, he lived to be in his 80s and all he ate every day was like Twinkies and beer. And I was like, how,
How you
you
still
know,
alive?
like somehow they just, I don't know.
Every day he called him, bring me a Burger King.
They're just made different.
Burger King? No, sit down. With cheese. Oh, wow.
Don't hear the message.
I know she told me. I was like, I got it.
All right, everybody okay? Ready to keep going? I know. All right, this one is just a regular UTI bladder infection. We talked about pyelonephritis, which was what, got all the way up into the kidneys. This one's just, normal. So cystitis, whenever you see cyst, I don't think people think of like an actual like a cyst or like a pus-filled thing. In this case, cyst refers to the bladder because it's technically like this big fluid-filled sac also, which is what the bladder is,
Right.
So the root cyst has to do with the bladder. Cystitis is the inflammation of the bladder. Urethritis, inflammation of the urethra, and that's just due to the infection, right? So the bacteria. So when you see cystitis, urethritis, it's AKA a UTI, a urinary tract infection. Okay. These are very common. Again, E. coli is the main offender, just again from the feces, right? But it's not always necessarily E. coli. It can be caused by viruses, fungi, and parasites as well. But E. coli is most common. They are more common in females because, like I said, the urethra is shorter, so bacteria have a shorter distance to travel, and also because of the proximity of of the holes, right? So women's holes are closer together than men's are. It's also more common in the elderly as well, just because hygiene tends to go a little bit down. People aren't able to clean themselves as well, and then also just your ability to fight off an infection decreases as you get older. And then thirdly, because of age, the mucous membranes tend to get more dry, right? And so when they're more dry down there, it's easier to get infection because the skin is kind of brittle and dry and not as healthy, so it's just more likely to get infected. So elderly females have a lot of UTIs. Okay, so symptoms-wise, if you've ever had a bladder infection, dysuria. Dysuria just means painful urination, okay? Frequency, feeling you have to go all the time, right? That feeling I have to go, but you don't really have to. It just feels like you have to go. Sometimes people, when it's really bad, especially in the elderly, they tend to have incontinence where they just kind of accidentally go on themselves. Depending on how bad it is, you might have, the low back pain, the fevers, chills, bloody urine, foul smell, and sediment. So sediment is remember we talked about the clarity on the urinalysis, how clear it is. So here's a picture of sediment in the urine. It's kind of that cloudy. This is the bacteria stuff. Okay, so this is an indicator of a urinary tract infection. Normally urine should be clear, right? You should be able to see through it. Even if it's yellow, you should be able to see through it. So this is pretty common of a UTI. Diagnosis, really easy. There's going to do urinalysis. They can find the presence of bacteria in the urinalysis, red blood cells, white blood cells, all that stuff. Treatment-wise, just going to be antibiotics. And this is an acute problem, although some people do tend to be more prone to them. So it's chronic in a sense that you're just prone to these issues. Like the elderly women, for example, might have chronic bladder infections. Pretty straightforward. Any questions about that one? Okay. All right. So we've got diabetic nephropathy. Okay. We talked about how diabetes can really affect the kidney. Okay. So this is just any kidney problems that are a result from diabetes. So with diabetes, these people don't control their blood sugars very well, right? So high levels of blood sugar, like I told you earlier, can damage the small little vessels in the kidney there. It's just very irritating. It's kind of like that sharp, spiky calculi I showed you a picture of. You can see how that would be irritating coming down the ureter. And I'll just imagine sugar crystals constantly in the kidney all the time. It's kind of the same idea. It's very irritating. So symptoms they're going to be kind of similar to what we've been talking about. So urinary retention, just not urinating as much, right, because the kidneys can't do their job. Hypertension, nausea, protein in the urine where it shouldn't be, getting frequent bladder infections. That's the other thing too, is that remember with diabetes, you're going to have sugar in your urine, right, because you just have so much sugar. You have so much sugar, your body's having to get rid of it, right, so it comes out in the urine. And remember I said bacteria love being in the bladder, right, because it's warm, it's got water, it's dark. Now, if there's sugar in the urine too, now they have an all-you-can-eat buffet, right? Bacteria love sugar. They eat sugar, they thrive on sugar, they start growing. So people that are diabetics with kidney issues typically have a lot more urinary tract infections because they've got so much sugar in their urine that feed the bacteria, keep them alive. Does that make sense?
Oh.
Yeah.
Would it be too, cause, what is this called? What do women get?
Wait, what?
The vaginal, what's it called when? Yeah, when you have the.
Yeast infection?
That's it.
Oh, yeast infections.
Yeah.
So a lot of times women get yeast infections from taking antibiotics, right? Remember we talked about C. diff, how you take a lot of antibiotics and it kills off the good bacteria in your gut, and then the C. diff takes over.
Yeah.
It's the same kind of thing. You have good bacteria in the vagina, right? And when you take certain antibiotics, it kills off all the bacteria, including the good bacteria, and then the yeast take over, right? So yeast infections, not always, but are often a symptom or a side effect of taking antibiotics, right? And then you have to go on an antifungal to get rid of the yeast. But there's other ways you can get yeast infections too. Getting older is one of those because it's drier down there, right? So when you're more dry, the mucous membranes start drying up. They're not able to fight off things as well, so yeast tend to take over as well. But yes, women are more prone to yeast infections. I think we'll talk about yeast infections and reproductive.
Okay.
Don't quote me on that because I'm not sure, but if we do, it'll be in that chapter. Let's see. Diagnosis, you guys should be seeing a theme by now that they're pretty much all the same. Blood tests, the done. Cholesterol, that just goes with being diabetic. The urinary albumin, that's the protein, right? So albumin is synonymous with protein in this case. The protein, there's lots of different types of protein. Albumin is the type of protein that shows up in the urine. Treatment-wise, again, diuretics, blood pressure control, and then specifically for diabetics, just keeping their blood sugars regulated. So, and we'll talk about diabetic treatments later, but just keeping your blood sugars within normal limits. And this is a chronic condition, right? This doesn't happen overnight. This is from constant, years of the sugars irritating the kidneys, okay? Questions? And then this is just kind of a picture of, again, the glomerulus where the filtration happens, and that's just the sugar being irritating and it breaking down, causing proteins to come out in the urine. I like pictures, so I include them. If they're helpful to you, great. If not, you can ignore them. All right, polycystic kidney disease. Poly means multiple, right? Like polygamy, for example. I was trying to think of a word that had poly, and it's the only one I could think of. So this one is referring to multiple amounts of cysts in the kidney. Okay, so this is an extreme case again, but this is a polycystic kidney. All these cysts everywhere, right? Again, an extreme case. But basically what's happening is that the healthy kidney tissue is being replaced by these grape-like cysts, okay? Usually occurs bilaterally, which means both of the kidneys. This can happen from just a genetic disorder, or sometimes this can happen with just constant long-term kidney issues. They can just start developing cysts. There's not one clear reason why. The symptoms, they can hurt. Everybody had a uterine cyst or a ovarian cyst. When they burst, they can hurt real bad. They're not life-threatening. They just hurt a lot when they rupture. But they can also make the kidney a lot bigger, so you can, with imaging you'll see that. Sometimes you can actually feel them, if because the kidneys are back here in the back. If you can press on the back, and then you can kind of feel a lump under there. That's what palpable upon exam means. Some pain, tenderness. You can also imagine there might be blood in the urine. If one of these ruptures and bleeds, right, it will get into the bladder there. Diagnosis, imaging is going to be a main one. They can see it, right, and then maybe a urinalysis too. There's really the only thing you can really do is dialysis and transplant with this. There's no way to cure it other than doing dialysis, because the kidney is not going to be able to do its job, right? You can see that it's just, there's no way that it can do what it's meant to do. So dialysis transplantation is really the only option, and this is chronic and progressive. So it starts, small and slowly gets worse. So here's an example of the progression. This is a healthy kidney, and you can see how much bigger it's getting as the cysts grow, and how there's a few cysts here, and it just progressively gets worse, unfortunately. Any questions about that one? Okay. All right, next we got neurogenic bladder. So the issue here is it actually originates in the neuro system. Okay, we haven't talked really about neuro, but basically, you have nerves that go everywhere into your body, right? Typically what happens here is the nerves get damaged or severed that go to the bladder, and so the brain isn't able to send signals to the bladder to allow you to control when you're going to urinate. Does that make sense? I saw a patient when I was working in the hospital. He had actually gotten a gunshot wound that got him in the spine here and severed the nerves down here. It was gang-related violence, right? And it was really sad because he was young too. He was 17,
Oh, wow.
you know? And so like these nerves got severed, and once you sever a nerve, like it's like the phone cord has been cut, you know, the landline, you know, back when there was landlines. You know,
Yeah.
it doesn't work anymore. So there's like no more communication from the brain to the bladder. And that's a problem because if you're not able to pee, your bladder can rupture, right? So with neurogenic bladder, these people are going to have to be doing catheterizations every time they want to urinate, right? So they learn how to do it themselves. They have to, what they call a straight cath. They, you know, insert a catheter every few hours, and they usually can't even feel, depending on how bad it is, they can't even feel like if they're full. Like, you know that feeling of like, oh, I gotta really pee?
Yeah.
Like you're like, oh gosh, I really gotta go, because those nerves are sending you that signal, right? But a lot of times these people don't even feel it because they don't have the nerves that work. So they just kind of have to straight cath themselves every few hours, which is, you know, pretty sad. Some of them have a continuous catheter that just stays in there all the time, and others they do it intermittently, or they, you know, do it every few hours. So that's.
Usually the young ones have that. Usually the young people have when they just do it the one time and
Yeah.
throw it away. They don't have that bad one.
Yeah, because anytime that you have something continuously in there, like you're increasing the risk for infection, right? So if they can do it themselves, that's better. A lot of times the elderly can't because they don't have the range of motion, or they can't see well, or they're just not capable of doing it, so they have to do the continuous one. But a lot of young people, they're able to do it themselves, right? Or they have like a parent that can help them do it or something. So like with the case of the guy I saw in the hospital, he had his girlfriend doing it for him, you know.
I tried pediatrics, and I had a child, and I used to go to school with her and have to cath her.
Mm-hmm.
She was in a wheelchair.
Yeah.
She got shot in her back.
She did. Terrible.
It was very sad.
Yeah. So that's that. Yeah, so the symptoms, like I said, lack of sensation, so they might not even be able to feel that it's full. They can't initiate urination, right? They can't make themselves go. So that's pretty much that. It's usually irreversible. Like if the nerves get severed, you can't fix that. Sometimes the nerves are just in shock. Like if they got hit and they're like swollen and inflamed, sometimes you can get the feeling back when the nerves heal. So you don't always really know if it's going to be irreversible or not until you've given it some time, but usually irreversible. And again, with this, the goal here is to prevent infections, right? Because remember we talked about urinary stasis, like the urine just sitting in the bladder. Bacteria love that, right? So the longer the bladder is just full and it's not being flushed out, you're more likely to increase your risk of infection. So that's why urinating regularly is good. Holding it for long periods of time is not good. All right, so this is a catheter. I said we had a picture coming up. So it's just this little tube that goes through the urethra into the bladder, right? And it drains the urine out. So that's what this little balloon is, just so that it stays put and doesn't fall back out. All right, next we got stress incontinence. This is just uncontrollable urine leakage. They might also call it urge incontinence. Stress incontinence is usually like, this is very common in people that have had a baby, right? Because the pelvic floor muscles get kind of messed up. But you know, people that say, oh, if I laugh or sneeze or jump, I wet myself type of thing, that's the stress incontinence. Urge incontinence is kind of the same idea, where like you feel like you really, really have to go and you kind of dribble a little bit, you know. So most women that have had a baby experience some level of this. It's very common. There are like pelvic floor therapies that you can do to kind of strengthen those muscles again, or like Kegels to help strengthen those muscles to prevent that from happening. Yeah.
Let me ask. My mom has that,
Mhm.
but she had a C-section with me. So does that happen when?
Yeah.
Even if she has a C-section.
I mean, they're all all the muscles are really close together down there, so it does happen with C-sections too.
Okay. I just think it's funny because she's like, oh gosh, I gotta sneeze and I'm gonna pee, and I'm like, Mom.
It can be worse with vaginal births because it's like stretching it out real bad, but people with C-sections can as well, because all the muscles, like people think it's just one muscle, but the whole pelvic floor is like tons of muscles. They have to cut through.
I think it's 9 layers, isn't it?
Yeah, they have to cut through all that to get the baby out. So like it's going to cause problems, right? So yeah, just getting older and pregnancy are risk factors there. So yeah, like I said, laughing, sneezing, coughing, jumping, whatever, anything that increases pressure, right, to have some leakage. I mentioned these already. They can do surgery if it's really bad, like if it's just like the muscle just needs some serious work. This is a chronic problem, but it can get better, like with certain medications, which we'll talk about at the end. There are medications that help with this, and physical therapy and things like that. All right, renal carcinoma. What is a carcinoma? Yep, good job. Cancer. All right, so this is just malignant tumors, and malignant meaning cancerous as opposed to benign, which is non-cancerous tumors in the kidneys. And nobody really knows why someone gets cancer. There's risk factors, right? But it's not like, oh, this is 100% the reason why you got it. So risk factors are generally always going to be the same: smoking, obesity, toxins, blood pressure, things like that. So those are risk factors for pretty much every cancer, right? Symptoms of this, the main one I want you to pay attention to is hematuria, because blood in the urine is a very classic sign of cancer, with renal cancer. Obviously, like, there's other reasons why you can have blood in the urine, where we talked about menstruation, or we talked about a kidney stone, like scraping the inside of your ureter or whatever. So don't freak out, like, oh my gosh, I've got blood in the urine, I have cancer, right? But this is like the main symptom, and it's usually painless, right? It doesn't hurt. Like with a kidney stone, it hurts, right? So like that there's a reason why there's blood. But with kidney cancer, blood in the urine without pain. You may notice an abdominal mass. That's just if you can feel the tumor, like you can feel it growing if it gets really big. Flank pain, again, that's referring to where the kidneys are. That's the flank. Weight loss, every cancer, we've talked about this. Anemia, I mentioned this earlier. Anyone want to remind me why you might have anemia with kidney issues? What does the kidney produce? What's that hormone? Erythropoietin, right? So erythropoietin tells the body to make more red blood cells. If the kidney's not producing that, then the body's not going to make any more. It's like your boss tells you, hey, do this, and so you do it, right? If the boss isn't there to say it, then you're not going to do it, right? So the kidneys are kind of like telling your body, hey, make more red blood cells, please. And without that, then you don't. So anemias are reduced red blood cells. What else? Diagnosis, they often find them accidentally, but imaging, right, CT, ultrasound, they can do biopsy to just find out if it's cancerous or not, the tumor. Treatment, they're going to just take it out. So that's what a nephrectomy is when they remove the kidney. So they can do partial, whenever they say radical, that means the entire thing. So if anyone says like a radical nephrectomy, that means taking out the whole thing, or a radical mastectomy, that means they're removing the whole breast, okay? So it depends how bad it is, right? If it's just a portion of the kidney, they can take out that part and leave the rest of it. If it's spread real bad, like this, for example, they just have to take out the whole kidney. There's no way to salvage that. Whereas like if it was just a piece of it, they could just cut out that part and leave the rest of the kidney, right? Here's an example of what a tumor might look like. And then the prognosis, again, it's hard to give a prognosis for cancer because it kind of just depends how bad it is. So you can see, like, this one has already started to spread, like it's gone into the lymph nodes and gone through the bloodstream. So this one's obviously, they're going to find metastases, like, on the CT, right? Whereas this one is, like, just localized to the kidney and hasn't spread yet. Make sense? Here's a real live kidney with a tumor. This yellow part is that tumor. All right, so that was a kidney tumor. Here's, I'm talking about some bladder tumors. Again, same symptom here, that painless blood in the urine. It's going to be the same thing. So this is just a tumor in the bladder itself, and the same kind of risk factors are going to be present. Just exposure to environmental toxins, like people who worked in some like factories with harmful chemicals and stuff, oftentimes get like lung cancer if they're breathing in like, toxic fumes that they're spraying or whatever. Kind of the same idea. It gets into the circulation. The kidneys filter all those toxins out. So the kidneys are likely to have problems because they're the ones that are filtering out those toxins. Like diesel fumes, for example, cigarettes, that sort of thing. Same kind of diagnosis. They're going to do a lot of imaging, ultrasound, CT, biopsy, same kind of idea. Treatment-wise, they can also do a partial or radical cystectomy. And again, cyst, whenever you see cyst, that's referring to the bladder. So cystectomy is a bladder removal. Nephrectomy is a removal of the kidney. Okay. There's also something called a TURBT, total, what does it stand for? Total urethral urinary bladder transection. I'm trying to remember what it stands for. Gosh. Total urinary. Don't worry about it. But basically, if they remove the bladder, right, the cystectomy, well, where's the urine gonna go? Right, it has to be collected somewhere. So they kind of create like a fake bladder for you. They take a piece of your small intestine and they hook it up to the ureter, so it kind of like forms a smaller pouch where you can hold the urine, and then they can hook it up to a little bag there. So very interesting. So let's look at these two again. So the nephrostomy I showed you is they hook it up right directly into the kidney to drain it. Remember when they had like that hydronephrosis and the urine couldn't get past the blockage, right? So they do that to protect the kidney. Here, like you don't have a bladder anymore, so they kind of have to create a fake bladder for you, okay? Both of them, ostomies, you notice, mean like an opening outside of the body. So we had the colostomy, which was the feces. We have urostomy, nephrostomy. So anytime you see ostomy, you should be thinking of like an opening coming out of the body, okay? Cystoscopy, cyst again referring to bladder again, and scopy referring to looking at a little camera. So they have like this. This is a cystoscope where they can stick like a tube in there and they can visualize the inside of the bladder. This is not comfortable, as you can imagine. This is a firm, like inflexible rod. So, because if it bent, you wouldn't be able to see past the bend, right? So it has to be straight for you to visualize. But they can view, like, see that's the tumor right there. They're able to look inside the bladder and see that. So that's the cystoscopy. And here's a picture what I was talking about earlier with the prostate, because I wanted to at least introduce the topic since we aren't going to get to it until the reproductive. But here's in males, right? Only males have prostates. Their urethra goes right through the prostate. When it gets enlarged like that, it makes it very hard to urinate through, okay? Now they can do a procedure where they kind of, well, I don't know what you say, like they swirl it around and take out all that extra tissue. It's like I don't know, like, they go like this inside and like cut off all the extra tissue.
How do you avoid that?
Yeah, well, it's pretty common actually.
Oh.
Yeah, most men typically around age 50 start having prostate enlargement. It's just, sorry, let you know, almost every man has some kind of prostate enlargement. Whether or not it's cancerous or not, it kind of depends on the guy, but it's extremely common. So first signs usually for men is that they're not able to pee as well, right? They're having issues peeing. So that's usually indicative of the prostate getting bigger. And that's pretty much it. We made some good time. Now we just have a couple meds to talk about. Not a ton. We talked about this one with the kidney stones, the one where it improves the urine flow. I made the joke about Flomax being easy to remember because it just maximizes the flow. Right, so tamsulosin, silodosin, doxazosin, what do they all have in common? Osin, right? So that's easy to remember. These, like I said, help to cause the ureters to dilate. They get bigger and wider so that stones can pass through easier. They often give these also for men with the prostate issues and to help widen the ureters. Like, again, and help the urine pass through. For UTI, we give them antibiotics, right? These are very common antibiotics that are given for a UTI. Nitrofurantoin, also known as macrobid, trimethoprim, sulfamethoxazole, often called Bactrim, and cephalexin or Keflex. Anybody ever had any of these?
I've heard of
Yeah, Keflex, Bactrim, Macrobid, these are like the most common 3 that are given for urinary tract infections. The other medication they have is called phenazopyridine, or you might see it over the counter as Pyridium or AZO. Ever seen AZO like at Walmart or whatever? This is not an antibiotic. This is actually just like it helps with the pain. Like when you have a urinary tract infection, it burns when you pee and it's very uncomfortable. This is a urinary anesthetic, so to speak. So like you take it, it doesn't fix the problem, it just addresses the symptoms. So dysuria, remember, is pain with urination. So this helps take away some of that pain. The other thing that's interesting about it is it will turn your pee like bright orange. So some people like freak out and think they're bleeding. It's just a natural part of the medication to do that. Then we've got the overactive bladder incontinence, the stress incontinence thing we're talking about, like where you're having a difficulty like controlling, like when you sneeze, like when you cough, or like you're feeling like you have to go all the time, right? They have a couple medications for that. Pretty common in like the elderly women population, or people that have had like really troublesome like pregnancies and things like that. But oxybutynin, also known as ditropan, mirabegrin, Myrbetriq, and Detrol, tolterodine. These are pretty common bladder medications to help control that leaking, so people don't have to constantly wear like pads or Depends all the time, to worry about leaking. And then we've talked about diuretics already previously in the circulatory chapter, so if you want to go back and look at that, you can, but I just put a few of them here again. Furosemide Lasix, this is the most common one. Hydrochlorothiazide, also known as HCTZ, very common, and spironolactone. And then, again, the blood pressure medicines, or the antihypertensives, I wasn't going to recreate all that and slide all over again, because it's exactly the same information within the circulatory chapter, so you can just reference that. The classes and the drugs are all the same. I just included them here again because we talked about the heart and kidney connection. So being aware that lots of kidney patients have to take blood pressure meds. Okay, and that is pretty much it. Finished with plenty of time. Anybody have any questions about anything on anything we talked about today in urinary? Take a few minutes for questions if you have any.
Men usually get the prostate enlargement thing. Can they just like bypass that? What if they're super healthy?
I don't think that really has much to do with it. It's kind of like elderly women are prone to UTIs.
Yeah.
It's just part of it. Older men are prone to prostate enlargement. It's just part of it. So everybody's prone to something. So, sorry. Hey, you never have to get pregnant, okay?
Whew.
You never have to give birth, so there's that. Anything not make sense? Anything want me to go over anything again? If not, feel free to knock out the quiz if you want. I think I have to make it visible. Hold on.